Today's talk is about balance in the vestibular system. How are they related, and how can physical therapy help? Uh, I know this group is related to hearing dysfunctions or disorders. I'm just curious, by show of hands, how many people have a vestibular condition, whether that's something that's they've been diagnosed with or something they've been working with for a while. How many people have a diagnosed vestibular condition? Can you put your hands up or give me a signal here? One, two, three, four. Okay, we've got several people. Well, we got quite a few people actually. Okay, okay, great. So for those of you with vestibular conditions, you'll find a lot of this information to be relatively specific to the conditions that you have. For those of you with purely or mostly hearing related conditions, you will be surprised at the direct relationship between vestibular dysfunction, hearing, and balance. Okay, so that's something I want to get across today. So, so a little bit more about me. So I've been a physical therapist for, I guess, creeping on 7 years now. I graduated from Samuel Merritt University in Oakland. In 2020, I did residency training with Kaiser to specialize in neurologic practice, seeing people with strokes, vestibular conditions, Parkinson's, anything neurologically related. In that same year is when I earned my specialty in neurologic practice. And then about 2.5 years ago is when I founded my own private practice called Homestretch Neuro Physical Therapy. Aside from all the fun PT stuff, I also have a dog. Her name is Shabu, and she is about 5.5 years old now, creeping on 6. And I also have a wife who's doing well too. She and I would travel a lot together. This is us in Vietnam a couple of years, 2 years ago. She's been a big support for the business as well. And so with my wife and my dog and I, we help manage the business and take care of things. Okay. A little bit about what I do in my practice. Again, my business is called Homestretch Neurophysical Therapy. I help people to discover movement beyond day-to-day living. And to do that, I come to the client. I visit them in their home. Oftentimes, I will also visit them in places that are important for them to function, like their workplace or the grocery store or a park or even a school. I've also worked with people in those kind of settings as well. It's one-to-one specialized services, totally private, where we focus on real-world skills in real-world scenarios. I make sure that all the sessions have a right amount of intensity, purpose, and personalization to each person's goals. I don't treat people based on a cookie cutter system. One of my first questions for anybody is always going to be, what's your goal? And then the rest of their treatment plan is driven towards that specific goal. And then beyond that, all I see are people or the only people that I see are people with neurologic disorders, whether that's stroke, Parkinson's, or vestibular conditions, as you might see later on in this presentation. Here's a brief outline of what we'll be going over today. We have a lot of time to talk about balance in the vestibular system, so there will be a lot of information that comes up. As Larry said, if you can save your questions for the end, that would be great. In the first part, I'll introduce what the balance system is and the different components of your balance system. In the second part, we'll take a deeper look into the vestibular system specifically and talk about some vestibular conditions. In part 3, we'll talk about vestibular physical therapy, what a physical therapist can do to really assess your vestibular system and your balance. And in part 4, we'll get to the main event, which is, what does treatment look like? What can a physical therapist actually do to help you with your balance and your vestibular system, or even your hearing system? So in part 1, I want to introduce the balance system. First of all, there are many different types of balance. There are 3 main forms of balance that I'd like to highlight. The first one is your static balance. That means standing completely still and doing nothing. You need balance to stay on your feet, and that's your static balance. The second one to highlight is your anticipatory balance, which is your body being able to anticipate a movement and holding balance for it. For example, if you're about to take a step, your body needs to be ready to take that step. It's also similar to, let's say, when you go down to pick up a box and you think the box is going to be very heavy, and all of a sudden when you pick it up, it's light, right? It feels different because you expected it to be heavy, but all of a sudden it's very light. Your body was ready and anticipating a heavy load, but instead you picked up a very light load, and the sensation is different. So that's your anticipatory balance. The third kind of balance is your reactionary balance, and that's how your body responds to unexpected perturbations. Maybe you're walking in a crowd and somebody bumps into you. You must react to hold your balance, or else you'll fall over. Maybe you're walking and all of a sudden you step on a puddle or something slippery. You must react in order to keep your balance, or else you may tip over. These three kinds of balance all work in sync together to make sure that you're able to stay on your feet and make sure that you don't fall. There are also individual components of balance, not just types, but components of your balance. The first component of balance is your visual system, using your eyes to see where you are in space and being able to lock onto different targets. The second system is your sensory system. So being able to feel what's underneath your feet, sense light touch, sense with your skin where you are. The third system, and probably the most important one to go over for many of you here, is your vestibular system. This is responsible for your sense of space, for a sense of where your head is when you're turning, and kind of integrating that into your balance as well. All three, your visual, your sensory, and your vestibular system, they work in harmony together. They're like gears kind of turning with each other and helping each other to function. What happens when one does not function properly is that your balance will be affected. So if all three gears are your balance system and your vestibular system is not functioning properly, you can bet that your sensory and visual systems will now have a hard time integrating as well. You need all three to work together, which is why when you have an impairment in your vestibular system, you will start to feel impairments in your balance. If you have an impairment in your visual system, like you can't see very well or you can't look at the ground, you will start to have impairments in your balance. If you have an impairment in your sensory system, such as numbness in your feet, it will be hard to balance. Okay. Let's dive more specifically into the vestibular component of your balance. So here in this diagram, you see what looks like a very complex picture of the vestibular system. And it is correct to look complex because it is quite complex. There are several different canals, several different lobes, several different crystals and things like that travel through the vestibular system and help to give you a lot of information about where your head is in space and where your balance is. A couple of things I want to highlight about the anatomy of the vestibular system. Number one is this. It's called the vestibular nerve. It's very special because it's a nerve that goes directly from the brain to the vestibular system. So it's evidence that the vestibular system is sending a lot of neurological input to the brain. There's this direct connection from vestibular system to the brain. Oftentimes in our body, the connection is not so direct, right? This is a cranial nerve. This is why it's so special. It's a one-to-one direct connection telling you that it's giving you fast signals and it's giving you a lot of signals. Okay? The second thing that I wanted to highlight regarding the anatomy of the vestibular system is this little piece right here that kind of looks like a snail shell, right? Many of you might be familiar with this area here. That's actually your hearing system, like your cochlea and other parts of your hearing system. Okay? If you look closely, you can see that your hearing system is directly connected to your vestibular system, right? There's that little snail shell piece, and as it travels up and kind of to the left side there, it's connected to all these little archways and other things. That's your vestibular system. Okay. Here we already have some pretty strong evidence that your hearing and vestibular systems are connected. Okay. And if your hearing and your vestibular systems are connected and the vestibular system is connected to your balance, you can bet that in some ways your hearing is directly related to your balance. Okay. So the function of the vestibular system, like I said, maintain your balance and give you an orientation of your sense of space. It has that really special cranial nerve connection with the vestibular nerve to help give you a lot of really direct supply of information. Some of the symptoms, and some of you may be familiar with this, symptoms of this vestibular dysfunction include dizziness, imbalance, trouble walking, nausea, vertigo, sense of spinning, frequent falls, headaches. These are all very common symptoms of vestibular dysfunction. Okay. Here are some of the more common vestibular disorders, things like Meniere's disease that are more episodic in nature, things like benign paroxysmal positional vertigo, aka BPPV for short. I think Larry earlier mentioned an issue with the crystals in his ear. So that's what BPPV is related to, the positioning of the crystals in your ear, and how sometimes when those are out of position, it gives your brain the wrong signals of where your head is. So that's what BPPV is. Other conditions includes inflammation of the vestibular system, so vestibular neuritis, labyrinthitis is another form of inflammation, or an acoustic neuroma, which is oftentimes an enlargement in some of the structures of your inner ear. These are just a few different vestibular conditions. There are many others as well. Some things to note about why it's important to understand the vestibular system and vestibular dysfunction. About 35.5% of US adults have some kind of vestibular dysfunction that needs medical attention. In fact, the medical attention could be a relatively high economic burden as well, because oftentimes people with vestibular dysfunction cannot work as properly, or just unable to go work, or unable to even go to the grocery store, or things like that. And that can cost them a lot in terms of money. The prevalence of vestibular dysfunction rises pretty significantly from 2% to about 32% in adults age 79 and older. In regards to falls and fall risk and balance, older individuals with vestibular and balance disorders have a 5 to 8-fold higher risk of falling compared to adults of the same age. Okay? That's very high. If you have a vestibular dysfunction on both sides, so your right-sided system and your left-sided vestibular system are both impaired, all of a sudden your likelihood of falling is 31 times higher. Okay? Not to scare you, but it's very significant, right? It's almost insane to think that your fall risk can be 31 times higher. And again, it's not meant to scare you. It's meant to show you how important the vestibular system is for your balance. Okay? It's meant to show you how important your hearing is for your balance. Without those things, your fall risk is significantly higher. And that's why we have physical therapists like myself and others who are trained in vestibular physical therapy to help provide exercise and activities to reduce this risk. Because we know the risk can be high. That's where your PT can come in and reduce the risk of falling and improve your balance. In regards to hearing specifically, this graphic is from healthyhearing.org. With hearing loss and falls, people with hearing loss do have a higher risk of falling than the general population. The more severe the hearing loss, the higher the risk. Again, this just points to the direct relationship between the hearing system and the vestibular system and the balance system. They're all interconnected in some way, shape, or form. If you have more hearing loss, chances are you also have a higher risk of losing your balance. Hearing, vestibular, balance. Okay. Again, all three are interconnected. We see the anatomy of the hearing system or the auditory system and the vestibular system are closely related. They're directly connected. And we can see how this plays into your balance as well. All three must work together in tandem to be functioning properly, right? If your hearing is not working, if your vestibular system is not working, even if your balance is physically not great, it will affect your other systems. Everything is related in some way, shape, or form. Okay. So that's the information I wanted to share about your balance system and your vestibular system. Next, we're going to go into what physical therapy actually looks like for vestibular dysfunction. There's a lot that a physical therapist can do for vestibular dysfunctions. There's a lot that a physical therapist can do decently, and a lot that a physical therapist can do well for vestibular dysfunctions. And so I'll be making sure to make that a distinction in the rest of this presentation today. There is a ton of evidence showing where PT is necessary in vestibular dysfunctions. Just a couple of years ago, a lot of researchers got together and released a 200-page document to guide physical therapists on what is the best evidence and what is the weakest evidence for testing and treating vestibular disorders. Okay? The fact that we have a 200-page guideline from a bunch of researchers should already tell you that this is a very serious role that we play in vestibular recovery. Okay? And it's not just a role that we play in preventing falls or restoring the vestibular function. It's really to make sure that you can still do your day-to-day activities despite maybe having a permanent vestibular condition or maybe having an acute vestibular condition. There are still ways to function in your day-to-day activities and prevent things like being stuck indoors all day or not being able to go outside because you get too dizzy, right? The goal is to make sure that you can still live your life in spite of whatever conditions you have going on. Here we are again with the sensory, visual, and vestibular systems, right? All three teeter-totter together to maintain your balance. They must work in tandem together. In vestibular physical therapy, this is exactly what we're looking at. You guys are lucky you get a sneak peek into exactly how I think when I see somebody with vestibular dysfunctions. This is one way that I think about it. When it comes to assessing people with balance disorders, we want to see how well the sensory, visual, and vestibular systems are working together. If, for example, your vestibular system is not working well, your physical therapist should be able to test for and assess that. What happens when one system is not working well is that the scales become tipped over, right? All of a sudden, the scales are tipped, your balance is off, things get a little bit rocky, and without it, we have an unequal balance system. We have a system that's not working in harmony. Your physical therapist's job is to be able to find this out, discover where exactly the scales are tipping, and discover where to rebalance this and what kind of activities and exercises you can do to rebalance the scales and get you back on your feet. For physical therapy assessment, there are several things that we need to look for. Ocular motor function, or the function of how well your eyes are moving. Sensory function, aka how well you can sense things physically with your feet or your skin. Vestibular function, so how well that vestibular system is working, how well your sense of space is. Balance, right? Your physical balance, do you have good balance on your feet? And number 5, strength and cardiovascular fitness, which are directly related to how well you can recover after, let's say, a vestibular incident or even with a chronic vestibular condition. I'll go over the first 4 in a little bit more detail next. Okay, so ocular motor function helps us to determine your eye control. Okay? Again, like I said, vision is very important for integrating your balance, and so we need to be able to see how well your eyes move. All physical therapists are trained at looking at movement. Eye movement is no exception. Some common tests that we'll take a look at for your eye movement is seeing if your eyes have full range. So checking eye movement in different directions. If you've seen a physical therapist for your balance, chances are they've done some tests where you're following their finger and assessing if your eyes can follow the finger well. Okay. They should be checking for nystagmus, or which is kind of a twitching of your eyes when you look one way or the other. They should also be checking how well your eyes move when you turn the head. That last piece is important because oftentimes when people have dysfunctions in this, when they turn their head, either the eyes are moving too slow or they're jumping too fast. And that's where you can get some dizziness, right? When your eyes and head are just not working in tandem together. With ocular motor testing, that's where it helps me to identify how well your vision is being used in your balance and what areas of your vision may need to be improved. With sensory testing, we're getting a look at your proprioception or sense of space in the limbs, making sure that you know where your foot is when you walk or know where your legs are when you walk. Sometimes this could be affected in people who maybe have had a stroke or have some kind of sensory issue where when they're walking, they don't feel their foot. They don't have a sense of space of how far their feet are swinging. We're also looking at light touch of the skin, making sure that your skin can actually feel things. When people have numbness in the feet, such as in like diabetic neuropathy, it can feel like they're walking on foam or walking on clouds. And you can imagine how difficult it must be to walk every day if you're walking on foam or clouds, right? That'll affect your balance pretty significantly. Okay. Again, sensation in the feet can directly affect your balance. So that's why as a physical therapist, I look at sensation as well. Vestibular testing. If you've seen a vestibular physical therapist, you've probably gone through a rigor of different reflex testing where you turn your head quickly or look at something and then turn your head one way, or maybe they take your head and they slowly turn you and look at what your eyes are doing. There are all kinds of very specific, skilled, and specialized tests that a good PT can do to really isolate the function of the vestibular system. In this case, we really want to isolate the vestibular system to determine how strong it is or maybe how weak it is. And from there, we can determine the best way to treat it. Things like repositioning maneuvers for BPPV, reflex testing, removing your visual and sensory inputs to see how well your vestibular system can function on its own, and other tests as well can be done. Once we're able to isolate those vestibular components, then again, the physical therapist should be able to determine the exact components that need to be treated. There's balance testing, which is number 4. Uh, most physical therapists should, pretty much all physical therapists should know somehow to check balance in some way, shape, or form. There are a lot of different tests that we can use to check for balance, and some of you may be familiar with these tests, such as the Berg test, which assesses your standing balance in static and dynamic positions. There's a functional gait test that evaluates your walking stability. There's a timed up and go test that measures your quickness and your fall risk. There's also a survey called the Dizziness Handicap Inventory that gives us a subjective outlook into how your dizziness affects your balance. Okay? The thing with balance testing and these kinds of measurable and numerical tests is that they really help to guide treatment planning. I use it mainly to show somebody their progress. If you score a 2 on one test and then we work together for 4 weeks and you go from a 2 to a 6 and then to a 10, you can start to see your progress and start to feel confident that things are working and that you will continue to do them to see more progress. Right? These are great to really guide treatment planning and measure how well somebody is progressing. Okay, so we've gone through the balance system. We talked about static, anticipatory, and reactionary balance. We've gone through your visual, your vestibular, and your sensory systems and how they relate to each other. We've talked about vestibular system specifically. We talked about its anatomy, its direct correlation with your hearing system, and the kind of conditions that can arise from vestibular dysfunction. And we've talked about vestibular physical therapy assessment, what your PT should be looking at, what they can look at, and how your PT can isolate different systems to get a better handle of what exactly is affecting your balance. Okay? Now that we can see what exactly affects your balance, it's time to figure out what treatment looks like. I kind of said it a little bit earlier, but this part is nice because you get a sneak peek, you get a window really into what I think as I'm working with somebody and how my clinical reasoning works when I'm trying to treat somebody with a vestibular system impairment or even with just a balance impairment. From a vestibular PT standpoint, there are three pathways that I can take when working with somebody with a vestibular condition or just with a balance condition. Okay? This is exactly what I think when I'm working with somebody. I think, can they work on adaptation? Can they work on habituation? Or do we need to do substitution? Okay? These are 3 different clinical reasoning pathways that will help to guide me for how best to treat your vestibular condition, how to best improve your balance, and how to best meet your goals. And how do we actually get you to your goals? I need to choose one of these 3 things. Okay? I'll go into each of these in detail next. Adaptation refers to retraining the brain to adjust for any changes that have happened to your vestibular system. If your right-sided vestibular system has been damaged for any sort of reason, there are ways to adapt to the damage and retrain the brain and make up for what's been lost. This is achieved through exercises that encourage your brain to use other inputs, use more of your sensory system, use more of your visual system, and so forth. Again, if you have damage on one side, now it's about using more of your left side, adapting to the situation, adapting to the damage that has occurred. Right? A lot of times with vestibular impairments, such as maybe you took a medication and it had affected or negatively affected one side of your vestibular system, and that side can no longer recover. Just because anatomically it cannot recover doesn't mean your brain cannot find ways to still function and still maintain its balance. That's why we have to adapt to it. So taking a look at this visual on the right side of the screen, here we are again with our balance teeter-totter. We've got the sensory, visual, and the impaired vestibular system. If my goal is adaptation with a client, I need to think, okay, well, if their vestibular system is not working properly, I need to find ways for them to learn how to use their sensory and visual systems more strongly to make up for what's been lost. And so my job is to help find exercises and activities to help you change the scale, move things around, reweigh certain things. So I should be thinking, okay, well, let's move things around. Let's change the priority. Let's move visual here. Let's see if we can reduce the reliance on some vestibular inputs, and let's see if we can rebalance the scales. Okay. Again, maybe the vestibular system may still be affected. It may not even anatomically improve, but your balance can still be achieved if we just adapt to the situation, use other inputs, and find ways to make up for what's been lost. That's adaptation there. Okay. The second option that I have for treating somebody is habituation. This relates more to somebody's symptoms that they might be feeling. Habituation is about increasing your body and brain sensitivity to the triggers of symptoms. I would guess that several people here have symptoms that occur when they're in a busy environment, maybe when they turn their head too fast, something that's motion induced or something that's visually induced. Right? A lot of times these symptoms can occur when there's too much movement in the environment, or maybe the environment has all these busy patterns and things like that. And the goal for habituation is essentially to get you used to it. Again, is to use repeated, controlled, progressive exposure to the trigger that's giving you symptoms to retrain your brain into knowing that it's okay to tolerate these things. Okay. This video is a nice example of what I would use to start training somebody in habituation. Let's say a client comes to me and they go, "Hey, Brian, I can't travel anymore because I'm really bad in crowded spaces. I can't walk around a crowded space without getting really dizzy because there's just too much going on." And I think to myself, okay, well, it sounds like we need to work on habituation. It sounds like we need to reduce your sensitivity to that kind of trigger. What I will do is instead of taking them to busy environments right away, we'll start with just watching videos of busy environments. So we would just watch something like this, where I would have them just sit and watch a video of somebody walking through a busy environment. This is a way for me to replicate the trigger for them and a way for them to control how much exposure they get to this kind of thing. Okay? So in this example, my client, I would tell them, "Hey, can you watch 1 minute of this video every day?" And then next week they come back, they go, "Hey, Brian, when I started watching it, I got really dizzy, but after a minute every day, it started to get better." And I would say, "Okay, let's watch 2 minutes of this video. Let's watch 3 minutes. Let's watch a different, busier video." And then eventually, once they're good at that, I would say, "Okay, can we go to the mall now at opening time and walk around and it's not too busy? And then can we go when it's busier? Can we go during lunchtime and see how well you tolerate those kind of busy environments?" That's habituation. That's getting them used to the triggering symptoms again so that they can go back out and function and maintain their balance without having to fear getting dizzy or nauseous because it's too busy. Okay? The next one is substitution. So we've gone over how to adapt to changes in your vestibular system or your hearing. We've gone over how to get habituated to triggering symptoms. That now in this part, we would need to substitute for something that has gone awry. Okay? This is the process of modifying your balance or your day-to-day activities in the event of complete vestibular loss on both sides. Okay? What I mean is that if your vestibular system on your left and your right side are completely non-functional, then if a PT is giving you vestibular exercises to try to improve your vestibular system, that's not going to work. You already know you have anatomically non-functional sides here. Okay? That doesn't mean your balance is done, right? You have to find ways to substitute for that. That can be by increasing the reliance on your vision, working on strategies where instead of turning your head quickly to look at something, you move your eyes first and then turn your head, right? That's a strategy. Or using your eyes to lock onto something to help with your balance and then heading towards that object. Okay, that's a way to lock onto something and improve your balance. You might find that if you're practicing balance on your own or with a physical therapist, sometimes they'll tell you, "Okay, can you look at this point here and then maintain your balance?" That's an example of using your eyes to substitute for balance. Another way to substitute is by using assistive devices like walkers, canes, things like that. I know some people are averse to using those things, but when you're in a situation where you really just don't have strong vestibular function on either side, then it might be time to evaluate using an assistive device so that you can still go out and function in day-to-day life. And that's substitution there. Okay. So next, what we're going to do is I will show you different videos of all these different treatment styles. Some of them will be about gaze stabilizing, right? How to use your eyes and how to retrain your eyes to work with your balance. And then the following videos will all be of my own clientele and how I would treat them and their balance conditions. Okay. Some of the people that you'll see in the videos do have vestibular disorders. Some of them may have had a stroke or other things, but all of them have a balance condition that needs to be improved. So here is a video on what it looks like to train somebody's vestibular system or visual system, sorry. So different ways you would train somebody, and some of you may be familiar with exercises like this, or would be locking your eyes on an object and turning your head back and forth. This is a good way to practice making sure that your eyes can move with your head without you getting dizzy. You'd progress it with speed. Again, you shouldn't get dizzy doing this, but if you do, then you know that there's an impairment there. You can also progress it with changes in direction. Okay. For somebody with conditions like BPPV, you might find that you get dizzy when you turn your head quickly, or maybe when you get up and out of bed, you get dizzy. That's where exercises like this that focus on turning your head and stabilizing your gaze are very helpful. Okay, moving on to the next. Oh, hold on. I'll get to the next. Oop. There we go. Okay, this client of mine, this is somebody who's had a stroke. Their goal was to be able to walk on the beach in Hawaii because they wanted to go to a brewery in Maui, okay, Maui Brewing Company. And so the best way to train somebody to be able to walk on the beach is to walk on the beach. He doesn't have access to a beach, but he does have access to a nearby playground. So we practice walking on sand. Okay? This is an example of using very specific activities and environments to help somebody reach their goals. Okay, this person now is walking on sand. They've been working on their balance for a long time, and it's really hard to replicate trying to walk on sand in a clinical setting. So that's why I will just take them to sand and focus on their balance there. Okay. You can see he's able to step, he's able to maintain his balance, even though the sand is shifting underneath his feet, he's able to tolerate the changes in sensation. Here is an individual with a vestibular condition, right? On one side of their brain, they have a vestibular condition. This is also an individual who is a pro level surfer. Okay? So the goal is to get back into surfing. One way to do this is to get them on a balance board and force them to try to maintain their balance in a surfing position or surf stance. Okay. Here you can see I've replicated surfing pretty well, right? They're on a balance board, they're in that same low surfing stance position, and we're practicing how to improve their balance while he surfs by mimicking the activity. Okay. He's getting a sensory challenge here. I also cued him to use his eyes to lock onto a focal point so that he can use his vision more and make up for the lost vestibular function. Okay. Here's another person with a balance and vestibular condition. This person was having a hard time stooping down and grabbing things from the floor. The reason grabbing things from the floor was important to them was because they have grandchildren that they babysit and that they enjoy playing with. So there's always things on the floor that they need to pick up. Sometimes they'll play games where they throw things with their grandkids, and then they have to pick up a lot of things after that. And so stooping, looking down, turning the head to look at different things was making them dizzy, right? It was also making them fall backwards. Okay? And so I couldn't have them keep falling, right? That's a big risk if they're falling often just from picking things up off the ground. And so I said, okay, we need to improve your balance system. We need to adapt to the situation. To do that, let's start practicing in a controlled manner how to pick things up off the ground. So just starting off with large objects, right? Slowly picking things up and off the ground, moving in one direction only, so that he gets used to this again, so that he can retrain his balance system to knowing that this is okay. Okay, one more time. Relatively simple, right? This is kind of the beginning stages of us working together. It's not too bad. It gets harder, okay? One of the keys to any good physical therapy treatment is progression. And so here I progress him by having him catch these in time, right? Not only does he have to grab the cones by the time the treadmill comes down, he also has to sort the cones properly. Blue goes to one side, red goes to one another side. I add a cognitive challenge to his treatment to really focus on making sure that he can maintain his balance despite having to work on sorting colors. Okay? Again, he's able to stay low. He's able to use his eyes to look at different things, and he's able to turn his head so that he can throw to different sides. Okay, integrating those head motions, integrating a challenging balance position of staying low. Okay, here's a fun one here. This person has a sensory impairment in their foot, and so he doesn't have a great sense of where his foot is landing when he's walking. He doesn't really know how well his foot is landing on his heel or if he's hitting his toe. So that leads to him catching his toe on many things on the ground. He can catch his toe on a small wood chip. He can catch his toe on a curb. He won't notice until he's starting to lose his balance and fall over. So what I did with him was I actually tied him to my foot and I said, okay, I'm going to give you a different cue. I'm going to give you more sensory input so that your body starts to understand where your foot is in space. So here we are attached at the foot ankle. I'm giving him resistance so that he has to push against it. And he has to maintain his balance, but also know where to step. Okay. The cue that I'm giving him is providing him more input, giving him extra feedback so that he can improve his foot positioning when he walks. If you look closely, you can kind of see his left foot turning in a little bit or landing pretty close to his right foot. That's because both sides are affected here. But his right foot is able to take a step that's pretty straight, very stable, and that's what we were aiming for. Okay. Here's another fun one. Like I said, when I think of working with somebody with balance conditions, I need to be able to juggle their visual, sensory, and vestibular systems. This is a person whose vestibular system is not that strong because of certain conditions that had happened to them, and so they were more reliant on their visual system. They just didn't know how to use it yet. And I said, okay, let's retrain your brain to use your vision more to maintain your balance and have more stable walking. And so what I did was I strapped a laser or a light pointer to his foot so that he can aim his foot towards a certain direction. And I said, okay, aim that laser straight and see if we can work on your walking and improve how well your feet are landing. I want you to look closely here between his left and right foot. His left foot with the laser is landing pretty straight. His right foot, I pause it here, his right foot has a very wide base, right? His toes are pointed out. He's walking very narrowly because he doesn't have a good sense of space on that right side. But on the left side, he's able to take a very straight step. His foot is straight because he's able to use his vision to compensate. Okay? That's an example of using your vision to make up for the vestibular loss on one side. And let's watch this a little bit further. I think he'll turn around. Again, you can see here, using the laser pointer as a cue to take a straighter step with his left side as compared to his right. Some wide steps there too. That's a good step. Okay. And then here, we don't always have to use fancy equipment for balance training either. Here I have a gentleman with vestibular conditions who is working on being able to step and balance in multiple directions. So being able to move up, okay, being able to move back like this. I'll fast forward, being able to move sideways as well. And also being able to move in kind of these crisscross patterns, one opposite sides moving together. These are just other ways to work on your balance and work on your sense of direction as well. In people with vestibular conditions or even some hearing conditions, some directions are typically more challenging than others. Some people might find that they fall to the sides more often, or some people might find that they can't step backwards without falling. And so that's why stepping in multiple directions as exercise is important to help maintain your balance and decrease your risk of falling. He still has the, yeah, there you go. Okay, so let's wrap up some key points for the treatment side of vestibular PT. I showed you a little bit of eye movement exercises, but I want you to know that eye movement exercises should not be done in isolation, right? There should be other things going on when you do eye movement exercises. If your therapist only gives you eye movement stuff, then it's not going to be enough to improve your balance. For the second piece, one of the most important things that I find in treatment is to be able to teach my clients how to progress themselves independently. I don't want to see people for very long. Okay? That's not the goal. The goal is not for me to keep people forever. My goal is to see them for as little as possible because that means that they're getting better, right? The only way that they get better is to be able to progress themselves independently. And so I teach them how to progress their own exercises and how to make things or how to keep leveling up in their treatment. Depending on the severity of your condition, vestibular benefits can take anywhere from 2 weeks to 12 weeks or even longer than that. Again, it depends on what's going on with you and how long you've had the conditions for. And last but not least, like I've said multiple times here, your personal goal should always be the foundation behind any treatment plan. Okay? You don't just want to fall into a cookie cutter system for treatment. You want to make sure that whoever your PT is knows what your goals are so that they can design your plan around those goals. Okay, so a lot of information here, I know. Let's wrap it up with a couple of key points. Your balance system relies on integration of visual, sensory, and vestibular systems. All three need to work together to create a harmonious balance system. All three can also be treated to create a harmonious balance system. Specifically, the vestibular system itself is very complex and directly related to your auditory system. As you saw, if you have hearing deficits, you have a higher likelihood of falling. To improve that, if you have hearing deficits, you want to work on your vestibular system, strengthen your vestibular system, or strengthen other systems to make up for it. A vestibular physical therapist should be able to test you for the exact areas of your balance that are in need of modification or improvement, and they should be able to see where they need to weigh up or down different systems of your balance. And lastly, any treatment plan should be highly individualized. It's got to suit you. It has to have your goals in mind, or else you're just falling into a cookie cutter system. You want to make sure that your vestibular plan is related to what exactly you want to achieve. Okay. That is the end of my talk for everybody. Thank you for listening. I know it was a lot of information, so hopefully it was helpful. Here's my contact info, but I think it's time for questions now.
Thank you, Brian. That's an excellent presentation. And I'd ask people who have questions to click the little raise hand at the bottom of your screen, and that'll put you in a queue to ask your questions. I see Michelle. Go ahead with your question and unmute yourself.
Yes, hello. Thank you from Wisconsin, first of all, for opening up your meeting to those of us across the country. Much appreciated. And this was a very good informational webinar. So thank you, Brian, for all your information. I have a kind of a unique scenario that wasn't touched on at all. So I'm really curious whether or not you've had any training or personal experience with vertigo, balance issues, vestibular issues resulting from air travel, specifically flying in an airplane. I had a really bad experience 6, 8 years ago, and then ever since, it's random. Once in a while, I'll fly and have absolutely no issues. And then other times, I will be slightly dizzy or somewhat dizzy. And I've been trying to narrow it down and figure out what the problem is, and it's just never consistent. So I'm wondering, it seems like I've narrowed it down to especially on the descent. It seems like on the ascent and the descent of the aircraft, I try not to bend over, because if I bend over to get anything out of my bag, throws me out of whack. So I know I probably have some type of, the positional vertigo thing, the BPPV or whatever. But I just flew last week multiple times, and I literally did not move on that airplane. So how can it be positional if I'm not moving? Is it when the airplane is turning as it's landing, or what could be going on? And how can I prevent it?
Yeah, so that's a great question. The reason you didn't hear that is because it's relatively rare. I will put it in the chat right now. of what you likely have, which is malade debarkment syndrome, which is a condition where somebody all of a sudden has issues when they're on a boat, on a plane, all of a sudden they continue to have issues once getting off, right? Or even once they start to ascend the plane or descend the plane, they continue to have issues despite the initial triggering plane ride to be over, right? Maybe you had the initial plane ride that all of a sudden you're like, oh wow, this plane ride made me really dizzy. I don't know why. And then all of a sudden it continues, right? This is probably the symptom that you have or the syndrome that you're having. I can't say for sure, right? It's been 30 seconds of information, but I think I feel pretty strongly about it, right? The reason you might be having this is probably more related to a habituation issue, right? I can't say for sure why all of a sudden your brain and body decided to say this is too much when I'm flying, and so here's a signal to tell you that it's too much. I can't say why for sure, but your treatment plan would probably be focused on a way to habituate the body and brain and get essentially used to it again. Whether that's finding ways to move you up and down in different settings, like I don't know, even like a slide or something like that to see how you fare there. Working on moving your head up and down, exercises to move your head up and down while you're going around places or while you're maybe even going in an elevator. These are type of examples that may be suggested to you by a physical therapist. I would definitely look into finding a vestibular PT and helping you there. It's a pretty tricky syndrome to deal with. Also because it sounds like you mostly feel it when you're on the plane, so it's a hard thing to replicate in a clinical setting. But I would see if you can talk to a neurologist or vestibular PT and say, hey, I think I have this MDDS. Can you test me and see what I can do?
Okay, clarifying question. What somebody recently suggested, and you just mentioned, airplane or boat issues. So somebody that gets seasick on a boat, there's apparently a patch that you can wear. Would that be the same kind of thing or different than flying in an airplane?
It could be a similar thing, right? But if some of your symptoms are more like spinning, not so much nausea, and a lot of
Right,
and you can't
exactly. Yeah,
even
it's
get
not
up on the
nausea.
yeah, with the vertigo, it's a little bit different, right? I mean, the patch may help. I give it a try, but you might still need some other form of treatment.
Okay, thank you.
Sure.
Okay, next up is Jerry and then Kenneth. Jerry, you're muted.
Okay. Hi, I'm in Colorado, and I am
Wow.
really glad that you did this because to add to this, I've got double vision. And so that's thrown my vision system off. And after reviewing this, some of this is information I've heard because I've been through some balance therapy, but I think it's time to go back and do it again. I think that you need to make sure people know it's like this is not a one-time thing, that you need to be evaluated. And it has been a couple of years, so I'm going back to my lady that puts my crystals back in my head and have her check me out. And the double vision has just added, an unbelievable facet to this whole balance thing. So I carry a cane everywhere I go outside. I don't need it in the house because I can touch things, but other than that,
Yeah.
I have to have it outside.
Yeah, you're an example of substitution, right? Initially, you had a vestibular condition where your crystals things were not in the right spot, so that's why you had somebody working on you there. But now you've also got double vision, right? You have an impairment in both your visual and your vestibular systems. What you're doing now is substituting. You're able to use a cane so that you can still get out and about, or just walk around while holding onto furniture. That's pretty common there too. And double vision is pretty tough, right? You're seeing your vision is not giving you the right signals, and that can lead to more dizziness and more imbalance. So it's appropriate that you want to go see a physical therapist again and work on your balance. There are still things you can do to strengthen your balance and make sure that you are not so quick to lose your footing despite having impairments in both your vestibular and visual systems.
System, of course, because that's why I'm here is I have hearing loss. And that's really weird because especially if you hear something over here, you don't necessarily know that it is over here. You just hear it and then are trying to find it. So you're moving your head back and forth real quick. And that will make me real dizzy too. So the hearing system just throws everything into another mix of things.
Yeah.
This has been really, really nice. And I really appreciate all of what you did, and that you're working with the specialization stuff. It's not just a physical therapy, but it's specialized physical therapy for those of us that have balance problems. I'm an orthopedic nurse, so I've seen way too many hip fractures.
Oh boy, yeah, I have to. But
All
thank you for
right,
that.
Ken.
Thank you.
Yes, thank you, Brian, for your excellent presentation. I know that the cochlea is anatomically connected with the semicircular canals, but can you say a little more why hearing loss causes vestibular problems? Is it because we're not getting the sensory hearing input that we use for our balance, or is it more complex than that?
Jerry kind of touched on it just a little bit just now, right? She said that I hear things on one side, but it sounds like it's coming from the other side. So my sensory, it's throwing off my sensation, or it's throwing off the inputs that I'm getting, right? That right there should give you a pretty strong cue already, right? We do rely on things like vision a lot for your balance, but our hearing also tells us where things are. If your hearing is affected and you don't have a clear signal of where things are because you can't hear as well, it's going to be hard to turn your head to where things are. It's going to be hard to know where you are in relative to the things that you're hearing. If it's hard to know where you are, that's going to affect the signals that your vestibular system gets too. Your vestibular system is responsible for your sense of space. Hearing tells you where you are. If you can't hear and you can't tell where you are, your sense of space will be negatively affected. And that's why hearing and vestibular and balance are all related there.
And do hearing aids, if you're getting adequate hearing aids, will that help that?
Hearing aids actually does reduce your likelihood of loss, statistically speaking. Yeah.
Right. And just one quick second question. Is retraining the brain age dependent? Do you do a lot better with younger brains than older brains?
That is true, right? Younger brains are more neuroplastic, which means they can change quicker. They can create more neurons and connections much faster than older brains, right? That's not to say that older brains cannot do it too. They can, right? The tricky part for that I've culturally noticed is that other therapists or clinicians or even personal trainers are not so great at pushing older brains to make those changes, right? We're hesitant because people are older, so we're worried like, oh, this exercise is too hard, this is too much for them, the heart rate is too high. But there's a lot of evidence these days to suggest that we need to do more intensity, more strengthening, more things to really push these older brains to make the changes we want.
Thank you.
I see, is it Margie or Margie?
Margie.
Okay, go ahead.
Thank you. Brian, I really appreciated your presentation. I had a cochlear implant about 5 years ago, and since then I've been going to balance classes, but I didn't realize how important it was to have specialization. And it sounds like people like yourself are able to give us better exercises, maybe that focus on our specific needs when we've had damage to our vestibular system. Am I correct that it would be better to know what exercises you need rather than just take balance classes at random?
I would continue taking relatively random balance classes, right? I think that's still strong enough to improve your balance or at least maintain your physical balance and prevent things from worsening. If you're taking balance classes and you're finding that you're still not improving to where you want to be, or maybe you have higher goals of, okay, these balance exercises, these classes are pretty easy, but I still need to have good balance to hop on a cruise in 6 months and maintain my balance there. If that's the situation you're in, then I would definitely recommend seeing a more specific person.
That sounds great. May I just ask you your phone number? I don't think I copied it down correctly.
Yeah, great timing. I just sent it in the chat as well, so you can find my phone number, email, and website all in the chat now.
Great. One last question now. If a patient's to come for the sessions, it could be anywhere from 2 to 12, or is this something that is covered under medical plans, or is this something that you pay for independently?
It depends on where you go, right? If you have decent insurance, and you might be able to go to a physical therapy clinic with a vestibular PT, then that'd be great, right? Because then you can use your insurance to see them, but it has to be hospital based, and there might be a few restrictions on how often or how long you could see them for. For myself, because my practice has a lot more freedom, I'm able to do longer sessions or more creative sessions with my client. But the caveat of that is that I can't take insurance, right? The insurance would normally not allow for some of these things to occur, like taking somebody to the beach. You can't do that in a normal physical therapy clinic. And so for that reason, my practice is all private pay. Some people can use their out-of-network benefits to see me, but aside from that, private pay benefit is that you get more creative sessions.
Thank you so much. Your information has been very valuable.
I'm glad. Thank you.
Are there any other questions? I only can see some of the people on the screen, so you can click the little raise hand. I have a question, and that is that many years ago, I rolled over in bed and woke up dizzy. And for the rest of the day, I walked around dizzy. I went to the doctor and she said, I want you to look up at the ceiling and then down. And I said, I know exactly what happens when I do that. And she diagnosed BPPV. Back in those days, they hadn't, I don't think, discovered physical therapy as a treatment for BPPV. So I've never had it. But in the meantime, I've developed a case where I can not look over my right shoulder without getting dizzy. But I don't get dizzy right when I turn my head. I get dizzy if I hold it there for a while. It doesn't happen to the left, but it happens to the right. My PCP said, well, that couldn't be BPV, and sent me to get sonograms of the arteries on each side of my neck and so forth. I just saw him and he said, well, maybe it is BPV, and but he wants me to have sonograms again. Is that, I've always thought of BPV being something that happens immediately when you turn your head, not when you hold it in that position. Is that right or wrong?
It depends on the type of BPPV. BPPV is a situation where some of the crystals in your inner ear in that vestibular system get dislodged, right? But they can fall into different places. So depending on where they've gone, there are situations where you turn your head and within 5 or under 30 seconds, you start having your eyes twitching and you get dizziness pretty quickly. There are other situations where you turn your head and there's what's called a latency period. So you don't feel it right away. Okay? But then after 30 to 60 seconds, something starts to happen and you start to get dizzy. You start to feel unwell. Okay? Maybe that's what's happening with you, Larry, is that you're having a latency period. And so you're having a specific type of BPPV. I would definitely see if you can find someone to help teach you how to do repositioning maneuvers for BPPV. Because if you've had it for a while now, it sounds like it's a more chronic condition. What you need to do is learn how to do these repositioning maneuvers independently so that you can give yourself a cure each time. You would do it on your own, then you go, okay, now I feel better. Or you do it for a few weeks at a time, then you go, okay, now I feel better. That's what you need to find. And maybe you could find a PT to help you with that. Or sometimes like a head and neck doctor or a neurologist is also experienced with that.
Okay, thank you. That's helpful. I see we'll have one more question, and Michelle has her hand up. You're muted, Michelle.
Yeah, thank you. I also thought of an expanded question after somebody mentioned cochlear implants. So I do have bilateral cochlear implants, one from 20 years ago and the second one not till about 8 years ago. And I feel like I didn't really have these balance issues until after getting the second cochlear implant. And looking back to the timing of when my issues started, I feel like it may have been close to after when I got that second implant. Now, whether or not it's correlated, I don't know if it can be concluded, but I feel like I have heard more issues on the cochlear implant Facebook pages and things like that. And our HLAA, we have a cochlear implant group. So I'm just wondering if anybody else here has cochlear implants and has issues, and whether or not, Brian, if you've heard of any correlation in your training and experience associated with cochlear implants, and specifically bilateral to cochlear implants?
I will tell you, I haven't had that experience with bilateral implants and vestibular issues afterwards, but I'll tell you what I think is probably happening. You had one implant done, and that worked out pretty well, and so your brain and body got adjusted to the new signals pretty quickly, right? All of a sudden, new signals, yay, it works out fine. At the second implant, your brain and body needed to adjust to new signals again, but it doesn't sound like that it's adjusted properly. Okay? Imagine if you wear glasses, and let's say you're Larry, you wear glasses every day, and all of a sudden one day you pick up your glasses, it's a new pair of glasses, but the prescription is wrong, maybe, or just for some reason they're stronger glasses. You put them on, and you go, oh my gosh, what's going on? Okay? That's probably what had happened to your brain and body when you got the second one, is that your brain went, oh, I can hear more, what's going on? And all of a sudden you start having these changes to your balance and your vestibular function, right? I can't say for sure that that's what has happened, but that's what I would think initially. Okay? And after a while, the symptoms just keep occurring because it has yet to get used to what's happened. That would be
So
my
would
guess.
that be any different would that be any different recommendation in treatment path forward versus what we were talking about earlier with that other DMM?
The
whatever.
MDDS? No, I would probably say it's still going to be a habituation style of treatment, right? Getting used to it, because now you have this new implant that's giving you new signals. It's about habituating to it, getting used to it again, and not letting your brain tell you that it's too much of a signal. Okay.
Okay, thank you.
Yeah, there are some questions in the chat that I see here too, so I want to make sure that I address these people. Somebody, I think in a direct message, had to determine if vestibular issues are right, left, or both sides. Depending on the test you can do, there are different tests to isolate sides. You can turn your head one way, and that'll isolate one side. You can reposition your body one way, and that'll isolate one side. There's a lot of even just looking one way or the other can tell you whether it's your left or right sides that are affected. In BPPV, you can usually tell based on the maneuvers that you can do to get tested which side is affected. There are a lot of ways to tell which side is affected or not. It's not crazy difficult to tell. There was a question about, please say more about why hearing loss causes vestibular problems on hearing aids. We kind of talked about that as well too. I think those were the only two that I see in the chat.
Brian, thank you so much. This has just been a terrific presentation, and I've learned things that I just never even thought about before. So I give it a hand of applause.
I appreciate that. Yeah,
all this help.
I'm glad the information was helpful. I do think a lot of this information is not that common to know, right? Especially for people who are older and have all these different balance issues. People tend to just kind of think, I'm old, so I have balance issues, and there's nothing I can do about it, right? But there's plenty that can be done. If there was nothing that can be done, then my field wouldn't exist in the first place, right? So there's plenty that can be done. It's just a matter of finding the right person to help you and making sure that they're skilled enough to help you work on your specific goals.
Thank you very much. We will now have a very brief announcements that I've been asked to give. And Brian, you're welcome to stay, or Brian, welcome to leave, whatever you prefer.
I think I heard one more question popping up somewhere.
I was just, for some reason, I haven't been able to get my hand up.
Okay.
But yeah. I just want to give a shout out to the vestibular PTs. I've been seeing one at Stanford for a number of years, and it has been really quite amazing. I have Meniere's in both, bilateral Meniere's, and my balance is very poor. And I will say the exercises have been quite amazing. And the assessment that was done was very, very thorough. And so this is, I know, an area of expertise that has been very, very helpful for me. And I really appreciate the fact that, this is an area that you, Brian, are working in, and others. And so I just really encourage anyone who's interested in it to do more research in it, because it's been really, really beneficial for me. And I continue to do the exercises that I've been given. And I can see when I don't do them, that that my balance is not as good, and so then I have to start, getting back into them, and I realize that I am losing balance when I stop doing my exercises. So they really do work. So thanks, Brian, for this presentation. It was great.
Sure. Thank you for that.
Thank you for that comment.